Welcome to Black Health Matters. I'm Darryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
Which one is,
Systolic.
okay, it's under 100. And which one is it that is an emergency? And it goes below what?
100.
100. That's
Yeah.
an emergency. Oh, okay.
Well, that's enough to warrant. No, I wouldn't say it's emergency. It's enough to warrant you finding out whether that's your normal, because there are some people who have a normal blood pressure of 90/60. And if that's your normal, then so be it. But you need to know that. But if I get somebody who has a pressure over less than 100, then I want to take the heart rate, see what the heart rate is, because the heart rate gives you an idea of whether this is something that to worry about or not. For example, the heart rate usually is substantially under 100, usually around 80 to 90. So if you have 90/60 and you have a heart rate of over 100, then I would be concerned.
Dr. Callender, what's that medicine that you can put under your tongue and bring your blood pressure down quickly?
Well, there are a number of nitrates will do that. Nitroglycerin and a number of nitrates will do that. Yeah, and you're right. There's that used to be the treatment for hypertension. You put something under your tongue and go down. Also treatment for heart attacks. But anyway. Okay, John. Well, it's interesting. We've talked about the human genome having been mapped in 2001, and we said it was accurate and it's complete. But now, 20 years later, 20 years later, they have finally completed the human genome, and that's interesting because makes you wonder the validity of what people say at times, because in 2001 they said they mapped the human genome, but what they said they done it incompletely. Now we say it's finally done 20 years later, and I think it's interesting because when we talk about ethnicity and human and races and so that kind of thing, that's where it became quite clear that we're all of the same race. Although that was known, the anthropologists have been trying to educate us about that since the 90s. But because of the social ramifications of race, it was convenient for them to consider race as though it were the humans were of different races, and we who are of black skin were of a different race. Now, of course, we know better, but anyway, now this kind of just completes it so that we all are aware that we're all of the same race. We have different ethnicities, different cultures, and a different lot of other things, but under the skin, we're all the same. So, and I thought it was good to educate you even further to see that even though we say things are what they aren't always what they are. And so that's why people question everything, because when push comes to shove, what we say is truth often is not truth. So anyway, any thoughts or comments about that?
Was our special guest that we had a few years back that was working on the genome? What's her name?
Georgia Dunstan.
Yeah. Where is she on this?
Oh, well, she started the first genome center at Howard University, and she worked with Francis Collins, who really worked with the genome and helped sponsor the first work that was completed in 2001. So she's been involved with this from the beginning, so to speak. And she now has her own genome center, private center. But she's still as active as ever.
I'm sure she's very happy that it's completed.
Yeah, well, of course, she talks, remember she talked about soul genomics and how the cell is speaking to us from God, and the real truth comes from the cell, and the nucleus is where the word is, and that's why your health is related to your behavior and your faith, because the soul and the cell are together. That's what she talked about with the soul genomics. Okay, I guess we can go to the next one unless there's any other comment. This is an interesting article that talks about endurance exercise more beneficial than resistance exercise. Actually, the truth of the matter is that the combination is what you need to look for. You need to have resistance as well as endurance exercises. The walking and the running are great, and I think the combination of the walking and running and the weightlifting, the resistance, are both beneficial. So I think that both of them together make for good health. I think that while resistance is the creme de la creme, I'm sorry, endurance is the creme de la creme. Without the resistance, I think it's incomplete. So I think you have to have both together to make a great exercise program. And we talk about weightlifting, and it can be exhaustive as 100-pound weights, but it can be as inexhaustive as 5-pound weights and 10-pound weights. So, how many of you combine both the endurance and the resistance?
Yeah, I do.
Yeah, I think it's good to do both. I think they both together make up for good health.
I do. This is Sylvia.
What's that?
I said, I do also. This is Sylvia.
Okay. Right. Now, this is a kind of interesting article. The Environmental Working Group is a group that looks into what's dangerous for us, what are the toxins that are in our foods and other things. And they came up with a list of substances which have pesticides in them, and therefore they call it a dirty dozen, which I'll share with you. And the top of the list is strawberries, spinach, kale, nectarines, apples, and grapes, bell,
Damn.
cherries,
everything I eat.
peaches, everything that you and I eat. And we talk about fruits and vegetables are important. And of course, all of these are fruits and vegetables. So, but the importance is the fact that they've found detectable pesticide residues, and therefore they looked at the ones that had the most. And then they also had a list of the clean 15, which avocados tops the list. Sweet corn, pineapple, onions,
None of
papaya, sweet peas, asparagus, honeydew melon, cabbage, mushrooms, cantaloupe, mangoes, watermelon, and sweet potatoes. So that these are products that show no detectable pesticides. And so anyway, it's interesting because as we try to stay healthy, we have to recognize that there are forces. Last week we talked about the plastic compounds. Today we're talking about the poisons that are pesticides that are in our foods. We talk about the processing of meats and that contain carcinogens, and these pesticides are similar.
You know, Doc, most of those on the good list have a covering over the top, like avocados and pineapples and papayas, melons and things like that. They have an outer coating that you have to remove in order to eat it. So they're protected. I don't know about the cabbage and mushrooms though.
Mhm. Yeah, Dr. Callender, I was quite surprised to see kale as part of
Topping,
the dirty
topping the
dozen.
list, the tops of the list.
Yeah, you know, there's been such a push, you know, for smoothies and putting kale and you know, spinach in your smoothies. I'm like, oh wow. But
Yeah.
you know, they say, you know, you can try to, I'm not sure how you can get them at home and try to soak them in some vinegar and water, and I don't know, you know, sometimes I do that, but like with my strawberries and my grapes, I'll take in water and some vinegar, let them soak in there a little bit and see if that helps out. But it doesn't change the taste, but I don't know how much of a difference it's made with a pesticide in them.
Well, you know, this article is just talking about foods that are not organic. And so anything on the Dirty Dozen list, if you buy it organic, then it doesn't have the pesticides. You don't have to worry about it.
What does
Right.
that mean, Darryl? Organic. I've seen that
Yeah.
1,000 million times with food and chemicals. What does that mean?
Yeah,
For
explain.
me, it means more money.
It does mean more money, but Darryl, explain to them what, when they say organic, what do they mean?
It means that the foods are not grown with pesticides.
Right, right.
It's
So
the
they're
pesticides
clean,
problem that make it unhealthy.
right.
Well, now it's the push to grow your own. You know, summer's here, spring, summer's here, to grow your own vegetables and try to can them.
And try to see, make sure that nobody comes around and shoots pesticide on them.
Look, or the squirrels taking them a bite of them and just dropping them. That was our problem last year, trying to grow the tomatoes and the watermelons and everything. The squirrels would have a good time. My husband had blackberry bush and birds plucked all those off. So we have to do a little better gardening this year.
Raccoon.
But I thought your comment about organic means more expensive is kind of accurate, because
Yeah.
the organic
That's when I go
stuff,
to,
as Darryl identified, do cost more money. That's one of the problems with Whole Foods and other places like that. And that's why they're in areas where people have a higher income, because they do cost more.
The greatest expense that we have in this country is healthcare. So if you want to get more expensive, that's paying for pharmaceuticals, for the drugs, for the cancer treatment that you need from eating non-organic food. You know, so if you really want to get expensive, keep on eating that cheap food because you pay for it.
Well, that's a perspective that you need to understand. Yeah.
But the irony is, why pay more for them not to put insecticide on it? Then it's cheaper not to buy the insecticide and not spray it. So that's marketing, or they're getting rich off of that.
No,
If they don't-
actually,
if they don't spray it, then the insects will eat them up.
yeah,
Before-
actually, it's more expensive to do organic farming because, okay, the reason why they use pesticides is to increase crop yield. And so you get, as a farmer, you get more product, you get greater yield by using pesticides. And so, and then the other thing is that you have to farm differently. Normally, you do animal and crop farming on adjoining fields, and when you do animal farming, it's not organic if you feed your animals antibiotics, and hormones, growth hormones to get fatter animals. But when that water runoff from your animal farming with the antibiotics and hormones, if it runs off into your crop fields, then that makes it non-organic, because now your vegetables are not only getting pesticides, but they're getting antibiotics and growth hormones. So in order to do organic farming, you have to farm it, and so that you have water streams away from your non-organic animal farms. And so it is a more expensive process. It's not a matter of, you take out your pesticides costs and you should have cheaper products. It's more expensive to do organic farming.
Thanks, Darryl. Okay. But
How
this,
do you keep the carbon out of it?
how do you keep what?
Carbon dioxide, which is bad for us. How do you keep that out?
You can't, carbon dioxide is with us always.
And all the plants need carbon dioxide to
Of
grow.
course, yeah.
Yeah, but
you
we
can't.
don't.
Yeah, we of course exhale carbon dioxide, but it's everywhere. Yeah. Now it seems like this is the day we're talking about problems, but the fact that the environment the air we breathe is polluted. What does the article say? It impacts 99% of global population, so that the air we breathe, the concentrations of nitrogen oxide are so high that it's unhealthy for all. And why is that? Why are we having so much environmental pollution? And of course, they point out that this is because of the fossil fuels that our engines and other things burn up and pollute the air. And this is something that is particularly a problem in the urban population. And it hurts people like Black people like us who have asthma, coughing, wheezing, and breathing, and all those other things. They contribute to our ill health. And when they looked at the quality guidelines, they found that there's almost nobody who's free of the pollution. And they say that you have 7 million preventable deaths because of air pollution every year. So they keep talking about taking rapid steps to improve air quality while we slow walk in that direction. So the climate crisis is a health crisis. We've taken a long time to even address it, but it's killing us. So it's something that we have to be sensitive to. Just as Darryl talked about the organic foods, the air we breathe is also another source of ill health. Any comments about that?
I'm thinking, Doc, about,
Yeah. What'd you say, John?
I'm thinking about all the electric vehicles that are coming up now. A lot of people are switching over. That I'm wondering the effect that it would have on the environment, because it still seems like the rates of pollution are still going up, even though a lot of people are, a lot of my neighbors are plugging up their cars instead of using gas now. So I don't know.
Much food for thought. I think that may be the long-term solution. And who was it? Tesla would be thrilled.
Yes.
Yeah.
They're, each manufacturer now has electric,
Yeah.
or at least hybrid. So
Right. Yeah.
Cinnabar.
all right.
Now now bedtime's linked with heart health, and They say going to sleep between 10 and 11, you have a lower risk of developing heart disease. Well, that's interesting. And of course, the data. This goes along with the discussion we had about daylight savings time and not having daylight saving time, having a standard time. This is similar in the sense that circadian rhythm is thought to be the essence of the problem. And so if you go to sleep at the same time every night and get your 8 hours of sleep, it's thought to be good for your heart. And that's just an article that I thought was interesting to have. I wonder if the study was analyzed to include the hours that you sleep, because that may be as important as the time you go to sleep.
Yeah, Dr. Callender, what about the people who, work the 12-hour shifts, who, or work overnight and sleep during the day?
That's right. Those are different. That's why the question is this factored into the analysis? And I don't know. I couldn't find any answer to that question.
I average 12 or 1 o'clock sleep because I'm retired, right? I don't have to get up in the morning. So I sleep usually until 8 or 9. But I try to get my 8 hours. And I'm just wondering, the time that you sleep, it says go to bed at that time. The time, the total hours of sleep is more important, I think, than the actual time you you go to sleep.
Well, they haven't done that study yet, so we need to. And this is just one of the studies that was done. And the point you make is a very good one that has so far. I haven't seen a study on that yet.
Dr. Callender, a doctor told me I used to work a overnight shift, 10 o'clock to 7 in the morning. And he told me that I was shortening my life by working those hours.
Some people think that, but haven't seen any data on that. That would be an interesting study.
I too worked that overnight shift, and I started working when I was 19 from 10:30 at night to 7 in the morning. And even now that I'm retired, or even when I had a day job from 9 to 5, I still didn't think about going to bed before 12:30, 1:30, 2:30. And even now, 2 o'clock, 1:30, 2 o'clock is my normal bedtime. You see, I'm up now. I went to bed at like 2:30 last night. So it's,
well, it's interesting how our bodies differ, and how some people can do well on 5, 6 hours of sleep and others can't. But yes.
Dr. Callender, have you heard about, well, they said as you get older, you need less sleep?
I've heard it, but it doesn't, there's no fact, it's not a factual thing. You need same amount of sleep regardless. And I've heard that rumor stated many times, but I've not seen any studies that confirm it.
I see.
Now, this is an article that should appeal to everyone, because we all are in the computer era, and most of us spend 2 hours a day on a computer. And this points out that there's a syndrome, computer vision syndrome, and headaches, tired eyes, eye strain, double vision, blurred vision, neck and shoulder pain is supposed to be a consequence of computer vision syndrome. And they talk about what you should do to reduce some of this syndrome. 10 or 15 break every hour. 10 15-minute focus on distant subjects. And we talked about how sitting is dangerous as well. Sitting, they say, is the new smoking. And so, but they talk about the kind of breaks that we need to take. If you develop dry eye, then taking eye drops. I think it's probably more common than we appreciate. Your back, bending your back and straining your eyes. And there's people who don't do anything other than look at the computer. Many people will now read their newspapers on the computer. So
Children are studying, they're doing more studying on the computer now. So, I mean, we know this is going to be a problem. It should be more pronounced in giving information out to children, and well, some of us who also stay on our phones and computers all day. How can we reduce the eye strain?
Absolutely right. That's why this is a good article to have, so you become aware of that headache you may get. It may be related to your computer work, or the back pain, or the eye strain. But you're so right. More education should be given to, especially the children and the adults who now use the computer as much as the children. Any comment on this, other time? Okay.
Dr. Callender, we're living in an age where a lot of people are working from home, and that's going to have an effect on us later. I think it's better to get up out of the bed and go to work, isn't it?
Well, it's going to make people reluctant to want to go back to work. And one of the problems we're having is that some people who started working at home don't really want to go back to work. They've gotten used to working at home, and it's a new syndrome.
It saves gas too, though.
Yeah.
And money for lunch and stuff.
And clothes. Yeah.
Yeah, but that's at the expense of your health, though.
That's correct. Yeah. Over 50% of the world's population is likely affected by this health disorder every year. And that health disorder is headache. Very common. So we're talking about billions who have headaches. And who has not had a headache? Anybody not had a headache?
No, I don't have.
I don't have headaches.
I don't.
I don't know that.
No, I don't have headaches.
I haven't had any since I went into menopause. Before then, I had at least 2 a month.
I haven't had any since I got divorced.
Okay.
Don't give me any ideas, Darryl.
Well, it's amazing how many billions have headache. And more common in females than males. But it's interesting, comment about the menopause and the role that estrogen has to play in development of headaches.
What actually causes headaches, Doc?
But so many different causes of headaches that it's hard to say. I mean, anxiety, vascular spasms, you name it. So
High blood pressure.
high blood pressure is really cause, when you get pressures that cause headaches, you're really in big trouble because most of the hypertension you have is associated with headaches. Headaches you get from hypertension when your blood pressure is in the 200 range and thereabouts, which is stroke levels. So yes, you can get it from hypertension, but of course that's from.
I was gonna say poor dieting also.
What did you say?
Poor dieting.
Yes. Yeah, of course. If you like a lot of salt, that can lead to that. Pork and other things like that.
I've heard the worst kind of the migraine.
Well, I'm not sure that that's associated with anything in particular, but that is about the worst headache you can have is probably migraine. And it's amazing the amount of money people spend for medication for migraine. It's interesting that they found that migraine was the second highest cause of disability and first among women under 50 years of age, emphasizing that point that you made about the hormonal contribution of estrogen.
Do men generally believe women when they say they got a headache?
Yes, I'd say yes, I believe him.
But
Especially
they
if
don't
you,
care.
They
I don't believe you're right.
think they can cure your headache.
When
yeah,
you're
that's
not using your head for what they want.
true.
It depends on what time of the day or night you claim you have a headache.
Well, I think it's something that is, when it involves billions of people, I guess it's a source of great concern. I'm not sure that we appreciated the importance of headache, although migraine is something that causes everybody to become attracted to it and it draws attention. But the headaches that are not migraine, that's another story. That's the one you're talking about.
What is the definition of migraine? What's the difference between that and a regular headache?
Doing that is you have a headache that lasts for days. And most people, when they talk about headache, they talk about it lasting for maybe minutes or maybe an hour. But this is migraine when you're talking about days and you can't even raise your head. You can't, when you've had a worse headache in your life and you've had a headache that doesn't allow you to get out of the bed, that's the kind of headache that migraine is. Of course, it's also a headache that may mean you had a ruptured blood vessel, but it's also, after you've done all the studies and eliminated that, it also is a disease entity that requires special medications that make it believe it's a vascular phenomenon that contributes to what is called migraine.
I'm looking at an article from the Daily Mail that says women are more likely than men to suffer headaches, with some falling unwell for at least half of every month. And it says that women are twice as likely to have headaches than men and twice as likely to suffer migraines.
Right. And this next article reminded me of Darryl, who's alleges that the cold shower is the answer to all ailments. No, that's an exaggeration. He doesn't say that. He says that a cold shower is beneficial. And this is an article that caters to his statement. And you have people who go to, in the winter, they go and take ice baths and you have Lady Gaga and Brooke Shields who take these cold showers to calm down. Actually, Darryl, you don't take them to, you take them to have good health, right?
Right. Well, a couple of things. After working out, uh, they let's see, what's the word? Um, after you put your muscles through stress, then a cold shower can calm down your muscles. No, it can speed recovery time from working out.
Hmm, okay. How often do you do it?
About 5 days a week.
Wow. Hmm.
Is that just cold water, or are you talking about ice?
Oh no, I just do a cold shower. I just turn the shower completely cold for 5 minutes.
Whew,
Yeah.
give me
Yeah,
the
these are
chills
these
thinking about it.
I'm
these
I'm I'm thinking about the athletes you see in the ice bath. What is that about? I think that's crazy.
that's the same thing, but they think that it speeds recovery time, as he says. And you have figures who, well, you have the people who go out in the winter, and they have that where they all go into the cold water, and it's kind of a phenomenon that they do. Uh, and you're right,
Polar
I've
bear
seen
club.
I'll,
your
gi-
polar
I'll,
bear.
give,
That's
I'll give you an example. When I run a marathon, marathon's 26.2 miles. Right after the marathon, within about an hour, you have trouble walking. By trouble walking, it's extremely painful to walk. Um, Usually, you can't walk or run for about a week after a marathon. Okay, immediately, within 3 hours of running a marathon, I'll take an ice bath and I'll stay in the ice bath for about 30 minutes and I'm just filling it with ice cubes and cold water. And from that
Mm,
ice bath, I'm able to walk without pain that evening, and I'm able to start some light running within a couple of days of a marathon. Um, it's obviously a marathon is pretty strenuous, but being able to do like the ice bath routine, like it. They say that max for most people is 2 marathons a year, but by doing the ice bath means of recovery, there was one year I was able to do 6 marathons in a year.
mm,
wow,
Oh,
So it really
phenomenal,
does.
phenomenal. Wow, it's
mhm.
amazing. Hmm.
And Dr. Calendar, I jump off of boats into the ocean, and I always have a wetsuit on. So and if it goes below 70 degrees, I'm not really getting in. Uh, Now, people don't realize that. I mean, even though 76 degrees is kind of comfortable, your body normal body temperature is 98. So between 76 and 98, that's enough. If you're in there unprotected long enough, you can get hypothermia, even at moderate temperatures, and hypothermia can actually be a cause of death. So, people who do the polar bear swim or whatever, they're in there for a minute maybe at most, which
Right.
yeah, I understand that. And the water is not going to be much below, if at all, below 32 or so.
Right.
Salt water can get a little cooler, I've heard. But if you're in there for a short period of time, okay. I have a friend who jumped off the boat at the South Pole and jumped in the water. Same thing. The water is warmer than the air around you. The air around you might be below zero. The water is zero Celsius or or maybe a little bit below. So, but this idea of the physical or medical benefit of this is still baffling to me. I don't really understand it, but it seems to work, right, Darryl?
Yeah, it works. The other thing is, I don't know how many coffee drinkers are out there. I don't drink coffee. I haven't for, I don't know, 30, 40 years, something like that. But you take a cold shower and, oh, gee, you will be really alert. So it greatly increases alertness. It's a whole lot better than drinking coffee because the effects last far longer. So, like a cold shower, you'll be alert for hours, like 5 or 6 hours.
Getting back to athletes, John, uh, sometimes these athletes um, uh, going through pain from playing ball or whatever, and getting in and putting an ice pack on and staying under the ice or ice water or whatever, that reduces inflammation, doesn't it, Dr. Calvin?
That's correct. Yeah, that's correct. Yeah, and you can see how this article agrees with everything that Darryl said. And it's just that it's kind of seems a little bit unnatural to jump in cold water, but the benefits are clear. It's clear the benefits are there.
Look where you're scrolling. Yeah, scroll back. It says, while association cold water immersion improve mental health isn't entirely clear, some research suggests that immersing yourself can trigger the release of stress hormones, could potentially explain the boost in energy post cold plunge. Actually, anecdotally, it's rejuvenating. It challenges people to see what they can handle. You feel really good afterwards. So, all the things I was talking about.
I know my beautician started to rinse my hair. The last rinse is cool water, not completely cold, but it's cool, and it's supposed to rejuvenate your hair. And her physical fitness person was there, and he also talked about that for when he's doing personal physical fitness, about cooling the body down and taking cool or cold showers actually rejuvenates your body and rejuvenates the cells.
Yeah, I
You
wash
see-
clothes in cold water.
You see where it says in rare cases it prevents cardiac arrest. So people who aren't healthy, for some it doesn't work, but I think it sounds like it's a good thing if you did it and got used to it. How long have you been doing it, Darryl?
Oh, gee. I think I started last summer, so close to a year.
Mm,
But I've been doing the ice baths for marathons since the early 2000s.
mm.
But the
Wow,
cold is almost a year now.
amazing, amazing. Very instructive, very instructive.
Carol, you didn't pick that up. I said I wash clothes in cold water.
I picked it up.
No.
Sometimes I just don't hear you.
Well, that's sometimes beneficial to us husbands.
I got it.
This is an article that has caused much distress. This is a situation in which a nurse made a mistake and gave the wrong medication, which contributed to a patient's death. And this was an unintentional mistake. And as a consequence of this, she was convicted of felonies and faces 8 years in prison for medication error. I wonder if there are any other professions where people go to jail for making mistakes, inadvertent mistakes like this. This is the first case that we know of where a nurse who was inadvertently made a mistake like that. We have people who have tried to kill people intentionally, which is a different issue. But this is a situation in which she made a mistake, owned up to her mistake, and of course the patient died. And the nursing profession and the medical profession all feel that this is something that is a mistake. It's very clear when you look at continuous quality assessment and improvement that the way to minimizing mistakes is to have people recognize the mistakes, share the mistakes they make so that we can prevent them from recurring. And we talk about systems thinking, meaning that if you have a problem, you change the system. You don't change the person so much as you change the system so that it doesn't happen again. And so this is something that's completely different from anything we've seen in the past, in which the inadvertent mistake when this nurse gave a paralyzer to a person instead of a sedative is something that has caused the medical profession and the nursing profession to rise up in arms against us. What are some of your thoughts about it?
Don't nurses have insurance and doctors have malpractice insurance to cover them?
But that has nothing to do with going to jail.
Wow.
No, that just covers it has nothing, doesn't protect you from going to jail.
Dr. Callender, I thought they had methods. I thought they supposed to look at the medicine, read the medicine, somebody else read it, then I get ready to give it to you. Then before I give it to you, I'm supposed to look at it. I mean, I thought that's what they did.
Well, apparently that's not what they do everywhere.
But is that what they do? Don't they do?
Some
Don't
places.
they check their cells and?
Sometimes, some places. I'm not sure that they do that every time. Pearline, are you still online? Pearline, I guess she must have left. But Pearline is a nurse, and so I was interested in hearing her opinion on that.
She's muted. Well, I think it's sad. I think it will limit our resources to become nurses. You'd be afraid to administer the medication. You would be hesitant. That hesitancy too can waste lives or cause more damage. I read this last night and I just felt it was sad. I don't know how things have been in the medical profession since then, but I'm sure the nursing community would have second thoughts on this or would decide maybe it's time for me to retire.
Well, it only happened last week, so.
Okay. Yeah,
You know,
I think it's sad. It is sad.
Under the stress of COVID, all the hospitals jam-packed with COVID patients, people dying and everything. And the stress has been put on the whole medical industry, I would say.
Right.
Something like this, I'm kind of surprised that it doesn't happen more.
Yeah, but you would think something would be in place.
That doesn't mean it doesn't happen more. It just means that this was recognized.
Well, it means that they bury their mistakes. You make a mistake and somebody dies, and if somebody else doesn't catch it, then that person is just dead.
The other thing too is going to jail is supposed to be rehabilitation. But there's no rehabilitation.
Punishment. It's not just rehabilitation, it's punishment.
No.
Anybody believe that going to jail is rehabilitation?
No.
I said supposed to be.
Yeah, supposed to be.
Nobody believes that that's rehabilitation except you, John.
I said it's supposed to be.
Oh, okay.
That's punishment. Man.
Yeah.
Being in jail for 5 minutes is punishment. not to speak of, they sent us there for how long? Yeah.
From the
There's-
standpoint of the deceased family, you know, they're looking at it as that I got a dead loved one
Mhm.
that's resulted from the negligence. You know, it's just not an inadvertent mistake. They said it was negligent. In other words, they should have done better. The reasonable expectation is that they should have performed better. But as a result of your negligence, I got a dead loved one.
That's correct.
Mhm.
And that's accurate. And there's nobody's denying that. The only question is going to jail appropriate punishment for somebody's mistake like that? That's the question. And as Janice made a comment, is that going to cause people to quit, like a number of nurses talking about quitting the profession or not going to the profession? Medicine, the same thing. Is this a legitimacy now for not only nurses, but physicians as well, if they make mistakes, to go to jail rather than to be sued for malpractice? Is this a precedent that is unstoppable?
I think this nurse should have got the death penalty.
No.
Is it incentive to
And you
do
do
better?
have to look at it. You do have to look at it from both sides. I mean, if it was your loved one and this happened to them and the nurse said, oops, I'm sorry. Well, no, you're going to have a problem with that. You're going to have to be where my loved one is. But still looks like there should have been something more in place to protect her. I don't know.
And I,
Well, it is actually is a system failure. So the system needs to be changed. More along the lines of the comment that was made earlier, that you have barcoding systems and other systems that check and double check that prevent it from happening. And so the system is what failed in this instance, as well as the nurse. And there's no question that it's malpractice and it's negligence. So that is not really the question. The question is whether in the future, should all incidents like this wind up with the medical professional people going to jail?
Dr. Callender, I know a few years ago, they had people that were taking off the wrong limb. And they started marking.
Don't say years ago. That's still happening.
Yeah, but didn't they, when I had my surgery, before they came in, the doctor came in and put an X where he was gonna go. He wrote an X on me. And we talked about what he was gonna do and everything. Like, you know, sometimes you need to do more and not do less, and stop worrying about how long something takes and just do it as long as it takes, if it is doing it for safety's sake. What we used to do when I was learning how to sew, they say measure twice and cut once.
Well, your
Because you
point
can't
is,
take back a cut. Once it's cut, that's it.
well, I think your points are well taken. And the only question is, what question we're asking now is does the punishment fit the crime? And of course,
No, I don't think so.
should the nurse go to jail? Any other comments about that before we go to the next? Go back to the next previous slide.
They need doctors, they need nurses in jails. Maybe do that.
Assign her to jail.
Yeah.
Not make her.
I don't think so. What other professions, if you make, and in every profession, every line of work, people make mistakes.
But if people don't die, if I make a mistake, if I'm a cashier, I give somebody too much money, the person's still living. But I think it's a greater burden on people whose mistakes end up in somebody dying.
What is the answer to the question, though? Do you think that this person should go to jail?
No, I don't.
No.
Anybody think that the nurse should go to jail for negligence?
I think she should get the death penalty.
No.
I know, but anybody else think? Yeah, you said that.
No.
Before.
I think they should be punished, but I don't think they should go to jail.
And the doctor who cut off the wrong limb, his limb should be cut off.
No, John.
You know, I think that.
Okay, anybody else think that the doctor or nurse who makes mistakes that results in the loss of a limb or loss of life should go to jail? So it's only John, huh?
I don't think it's a criminal offense. It's an error, but you know, they maybe should lose their license or something like that, you know, to practice, but not even that is trauma, you know, to have someone whose life was based on that profession to lose their profession. That's traumatic. To have them locked up, I think it's overkill.
Me too.
Yeah, but
Well,
suppose,
I can't make a call because the Bible says don't judge.
but Darryl, you are an insurance agent, so you kill somebody in your car, so they're just gonna take away your driver's license, is that all?
But John, when people have homicides by car, they don't go to jail for the rest of their lives.
Well, this
They
They
lady,
get
go
their
to
is
jail
license
for
taken away.
short periods of time.
Yeah,
Well,
they
this
get their
lady's only going
license
to-
taken away.
she's only going to jail for 8 years.
Yeah, but they don't go for long, and they get their they can get their license back too in a lot of states.
I wonder, I doubt it. After you become a felon. She's committed a felony. And once you become a felon, there's no getting your license back.
Oh no, I don't mean that license. I mean driver's license.
Oh, I see. That's what you're talking.
But Dr. Callender, doctors that make mistakes and they call it malpractice. This is a nurse that made a mistake. So there's doctors don't lose their license if one of their patients during their malpractice and they have to go to jail. So why all of a sudden does a nurse have to go to jail because of malpractice? That does not seem fair nor logical.
Right. That's why it's causing so much a discussion, because this is the first time it's ever happened.
Yeah.
Well, they're saying that actions rose to the level of criminal negligence. So you have to have more details on exactly what she did. But it seems like it had to be much more than just an ordinary mistake, because it rose to the level of criminal negligence.
Well, the mistake is that it actually goes in detail in this article. And it tells you that she gave a paralyzing medication, which starts with a V, in place of another sedative, which starts with a V. And she didn't realize that she had given the patient the wrong medication. So it was negligence, and it's a mistake. The only difference is that she's the only person who's ever been put in jail because of see, it says here what it was. Vicuronium, which is a paralyzing medication, instead of Versed, which is well known as a sedative. So they then said that this was risen to the level of criminally negligent homicide. I'm not sure that I would agree. I don't know whether this was a judge or a jury that found this, but and that's one of the things about going to court. You never know what's going to happen. They say justice is blind, and that's not necessarily a good thing. But I don't think it's necessarily a good thing.
We know justice is not blind, because if she's
I think justice is blind.
1, she's a woman. 2, don't know what race she is.
Yes, we do. Her name was Redonda Vaught. You know good and well what race she is. Redonda. That's like LaQuisha.
Huh?
That's like Redonda is just like LaQuisha.
So she's a Black woman, and I bet you she's not beautiful. I mean, there's so many variables that come in there, and if she's got another lawyer, somebody has a better lawyer, justice is not blind. It's what
This
type
is
of lawyer
Tennessee,
you get, who you are, and what part of the country she's in.
Tennessee.
She's in
He's in
Tennessee.
Tennessee.
Tennessee. Oh man,
Tennessee.
that tells you what it is. A Tennessee black woman. Oh man, we know
Well,
what's happening.
but we were okay, but so it sounds like there's only one person here who believes that she should go to jail for this.
No, he was just joking.
He can speak for himself, Carol.
Oh, okay.
Right.
But anyway, so I just thought it was interesting because the AMA has come out in opposition, and the NMA, I'm sorry, National Medical Association has come out in opposition, and the American Nursing Association has come out in opposition. So it's going to be interesting to see what happens. Justice system may not be blind, but it has done some horrible things in its time. And this may be another one. When you think about all the times they agreed with slavery and all of the injustices that they've been associated with, you know that justice is awful. Whether you call it blind or not, it's awful anyway. So anyway, this is another instance in which justice is questionable.
I have a friend that is working with the prison system in Alabama, and she's saying there are some women there that are getting 8 to 20 years for stealing a loaf of bread. So it is injustice going all over, you know, especially in certain parts of the South. It's just that we're becoming aware and they're being publicized, but they are convicting, and particularly our race, for just insignificant things where they get off.
Not to speak of all of the black men who've been accused of murder and have died because they weren't treated fairly. So, yeah. Okay, well, you can go to the next line. I think we've discussed that enough. This is something old that's become new again. It's 68 attendees of a high-profile DC dinner test positive for COVID here in DC, and you can see that Biden's comment and his cabinet.
Yeah, Perlene needs to mute. There you go.
Yeah, okay. Yeah, so it's still going on, even though we say the pandemic is gone. It's very, very much still present. And I just had a coworker who became positive after going to Las Vegas. And then we know recently that Kevin Harris's husband and others tested positive. So, and when you look at that, you realize that people are not wearing masks anymore, most places, and public events. So it's not surprising. Even the president isn't wearing his mask anymore. So, so it's still dangerous. Question is, should we start masking again, or should we have ever stopped masking?
I
These
never
are questions.
stop. I wear mine all the time.
Me too.
Come on.
Yeah.
Dr. Callender, I caught COVID at a banquet, and I had my mask on the entire time, unless I was on stage or eating. And I'm sure now that that's how I was exposed to it. So these banquets You know, it's just like you're indoors with no mask. Anybody in there who had it, who's around anyone else who even didn't have it or was vaccinated, boosted, and all that, is still gonna test positive after that. You know, the only real comfort is that, you know, you probably won't get real sick and die, you know, but it almost seems like everybody's going to get COVID.
Yeah, seems that way. And so the beauty of it is if you're vaccinated, you're not going to be hospitalized or die from it, which is what the purpose of vaccination is for anyway. So now this is another problem, long COVID. People have symptoms for months after getting COVID. It's having symptoms long after the initial virus infection is over and symptoms persisting with chronic fatigue and other problems. And that's not something we have become good at treating. But it's something that is in existence.
Dr. Callender, is this for individuals who were not vaccinated and got COVID and recovered, or is this long COVID associated with like John and Darryl who got COVID, they were vaccinated?
I think that, I don't know if the studies have demonstrated it, but it's initially related to those people who had COVID before vaccination.
Oh, I see.
And I don't know if we've tested it enough on those people who have been vaccinated, because remember, vaccination's only about a year old.
Right.
My cousin Rodney got COVID in March 2019, and he was on a respirator for 14 days in the hospital for a month. And so he still has a long COVID with brain fog 2 years later.
Yeah, yeah.
I got a neighbor that's had COVID twice, and this was before the vaccine, and he still can't smell or taste.
Yeah.
And his
So,
wife had it, and she's got the like fatigue,
yeah,
like that syndrome that they had from the fatigue.
yeah, yeah. So it's not a disease to play with. So, and the vaccinated ones seem to be better off, but time will tell. And we haven't done enough studies on those who had breakthrough infections. But for the most part, they certainly have fared much better than those people who got the initial COVID before the vaccine and before treatment. Somebody asked me the other day, they had COVID vaccinations too, and they developed COVID. And so they asked me whether they should get a booster. What are your thoughts on that? Any
Yeah.
ideas?
I just got my second booster.
Right.
Yeah, I think the booster is really, especially for elderly folks like most of us, and anyone who's immunocompromised. Even if you had COVID and recovered, you might have to wait a little bit after you have recovered in order to get the booster. But even though recovering from COVID gives you super immunity, right? Because the antibody levels are so high when you have recovered. So they might delay giving you the booster after you have completely recovered from getting it.
And many studies suggest that if you have a breakthrough, you don't need a booster if you've already had your booster. You had a first booster and you got a breakthrough. They are suggesting that it's a booster may not be necessary for that person.
Dr.
May not be
Callender,
necessary.
Yeah.
I sure can't hurt, so I'm going to get my second booster this week.
Yeah, I got mine last Thursday.
will the COVID ever be what is called autoimmune?
No, autoimmune means that it comes from within, and COVID already is from without.
Gotcha.
DC has they come to your home, give you the shot, and that's what I did last week. I my aunt and I had it at her house. After I was on the call with you all, I made a call, and then they came the next day.
Wonderful, wonderful, good.
Yeah,
How was that work?
the system in DC is really awesome. Coronavirus DC, I have to have a test in order to go to work on Saturday. I'm performing at the Kennedy Center.
Really?
Kennedy Center requires horn players and singers to have a negative PCR within 72 hours of the performance.
Really?
So, I went online, and DC Health has facilities all around the city. So I went right up the street, Friendship Heights. They have a facility there right on Wisconsin Avenue. You can go in, you can get a shot, you can get a booster, you can pick up rapid tests to take home. You could get a PCR test right then and submit it. It's really really awesome, and it's for DC residents. It's free. Just walk right in. You could do it now. Anybody in DC, all you need is a driver's license.
Where did you go, John? Where did you go? I can take my mom.
The one I went to is 5335 Wisconsin Avenue, right up the street from the Cheesecake Factory.
Okay.
Across from Mazda Gallery.
All right.
Yeah, it's closer to the corner than that address, but it's closer to Western Avenue. It's almost to Maryland.
Okay.
Mhm.
Thank you.
You're welcome.
Okay. All right, let's go to the next one. Well, one of the questions is, why don't we just make this an annual COVID vaccine instead of all this boosters every 6 months, booster every year, just like the flu vaccine. And that's what they would like to see. And I think that's what is likely to happen. But time will tell. But for example, those of us who just get these boosters in April and May, when fall comes around again, it probably makes sense to get at the same time you get your flu vaccine, get your COVID vaccine.
Yep.
And that may be the sensible thing to do. And it's very clear that the group that is most likely to be victimized is the group above 80 and above 65, but especially those above 80. Yeah.
I'm thinking, Doc, how we have to have different flu vaccines every year based on, I think they study what's going on in Australia in the Southern Hemisphere, because they have their summer while we're having winter to prepare us for the next strain that's going to be dominant. But I heard this year they messed up. They don't have a matching vaccine for the predominant strain of the flu for this year. But even at that, the levels of flu are so low relatively because of all the COVID precautions that were taken with
Yeah,
hand
wearing the
washing
mask.
and masks and social distancing. It's kind of become a part of us now. That's what I think. I mean, you go in the grocery store, people aren't pressing up against the back of you now. They're separating a little bit. It might not be 6 feet or 9 feet, but they're not bumping all up into you now. They're giving you space. So I'm thinking that it says you can't really plan on what's coming with COVID because you don't. There is going to be another strain.
Well, I think the proof of the pudding is in the eating. And last year, the flu vaccine was not very effective, as you mentioned. And still, the flu season was mild. And I think it's primarily, as you mentioned, because we use those COVID preventive measures, a mask and keeping away from people. And I think we need to continue that. Hopefully, when you get that flu vaccine and the COVID vaccine, we will also continue some of those practices that have minimized the flu rate of last year. In spite of the fact that the flu vaccine last year was one of the least effective ever.
Dr. Callender, I have a good question for you. I have a friend I saw at the Giant the other day. I was shopping. She had a mask on, but she said, "You don't want to get too close to me because I've not been vaccinated, and I'm not going to be vaccinated because of all the news about blood clots and strokes and heart attacks and all this coming." And I said, Sonia, look, those reports are sensationalized. You hear about those, but there may be 1% or 2% or maybe 3% of all the people who have been vaccinated may have those kind of negative effects. What else could I possibly say to her?
There's nothing you can say to her because she's already made up her mind. So it's probably nothing much you can say. And people who haven't made up their mind or unsure and they really have questions, then those are people you can share the data with them. But people who've already made up their mind about why they're not going to be vaccinated, I think you have to leave them alone. If they ask and they want you to help them, you can. But I think that they've already made up their mind. So,
Dr. Callender, I've been saying, well, you need to get your finances in order. Be sure you got a will. Be sure you got everything in place, and you are ready to leave this world. And so that you will not leave your family with any burdens. Get that will in place. Be sure names are on the accounts. I mean, I'm just being honest with them. That's what you need to do.
that's one way of handling it. Okay, but anyway.
Dr. Callender, I was on a session the other day with a group of presidents for this convention, and they were telling us that we didn't have to get tested, but all we had to do was bring in our vaccination cards. And there was one lady who said it was religion, why she didn't get it, and was just belligerent and wanted to fight because people were insisting that she get a vaccination or have a vaccination card. Nobody touched her or anything like that, but it's just like she was totally mad and wanted to fight somebody because someone even mentioned that she should get vaccination. And I was just trying to figure out why was she so angry about it? And whether or not she attend this board meeting or not, because she said nobody's that's taking her Christian right away and all this kind of stuff
Oh,
about
good.
her getting vaccinated. And I'm going, she was just, but nobody antagonized her, said anything. They just let her sell her wolf tickets. And they said, we'll check into it so she could calm down.
Mm.
But sometimes
tell-
they just become belligerent. They're just mad. that
And tell her
somebody-
get, tell her
Huh?
get her will together. Tell her get her will
Oh.
together.
I wasn't gonna tell her anything. Didn't want to hear her mouth anymore. She was just mad.
Yeah.
She won't
Well-
be involved in the convention though, because she won't be able to get in without it. So to heck with it.
Yeah, she can't get in, and we're not gonna change the rules just for her, but she wanted us to go upside down, and I didn't even question what part of the country she was from. I was just saying,
You
okay.
just tell that kind of person, bless your heart.
Right. Yeah. Well, this is an article that suggests that COVID, which we already know, is here to stay, and that the cases are going to rise as they have. And the other problem is that the fact is that we're not acting like COVID existed anymore, and that's another problem. And so we think that we're immune, and for some people, that's true if they've been vaccinated. But that doesn't mean you can't get infected with a breakthrough infection. And it is true that those people who get COVID as a breakthrough infection usually are not hospitalized, and they're not going to die. So it's important for them to have access to at-home rapid tests and other things. But it is expected by most of us that the COVID cases are going to rise again, and they have already risen in DC and Maryland and Virginia. And I expect it's likely to do so. I don't expect the hospitalization rate will increase as much, except in those who are not vaccinated, that group of people who you've mentioned today. So I think that is significant for us to remain cautious, particularly those who are over 65. And
Dr. Callender, did you say that the hospital rates are not increasing now?
so far, except among those who are not vaccinated.
Yeah, and I think I heard something where they said it may be attributable to individuals now getting those test kits, and doing their testing at home.
Yes, that's true. That's another reason. Yeah.
They're not reporting positive tests.
That's correct. Yeah. Okay. Let's go to the next one.
This is the last one, Doc.
Oh, good. Okay. I thought I put this in there because it's interesting the way Hampton resolved the student balance problem by dissolving all the balances for the spring semester. Of course, by this time, many have already paid, but some haven't. So I thought it was interesting that the president decided to do it that way. That was a unique way of handling it. I think the students would be all pleased, except those people who had already paid their fees. I wonder what their reaction will be. But anyway.
It makes some students not pay.
Well, those who didn't pay probably are excited. Those who already paid are probably saying, hey, man, I already paid it,
That's what I'm saying. Maybe they may not, for the next semester, they may not pay just to see what'll happen.
Well, it's interesting to see that Harvey's made $100,000 matching donation. So it's interesting that that's one way that they chose to handle that situation. It's gonna be interesting to see how they respond to that. That's very, because I know Harvey was under some pressure to step down anyway, so be interesting to see how this helps his image. He's been there for almost, what, 30 or 40 years as president of Hampton?
Mm.
Yeah. Anyway, it's interesting to see how things are going. We got a notice yesterday that the president for Howard is stepping down as of June 2024. So change is occurring everywhere. Any other comments, final comments?
Why is he stepping down?
He's had enough, I guess. 10 years is enough.
Oh, okay. He didn't mess up or anything, did he?
I gave you the reason. I answered your question.
Oh, okay.
I don't think, Carol, if he had messed up, he wouldn't be talking about 2024. He'd be saying
Right.
immediate.
Yeah, as a matter of
He'd be
fact, I
trying to
think,
get out of town.
yeah, I think 2-year lame duck period is too long. I think 1 year is plenty, but anyway,
Yeah.
yeah, but anyway.